Elizabeth, your body is not working well in which place?
I'm having sciatic nerve issues,
Aha.
so it keeps me up at night. It's just like an electrical current just runs.
Yes, of course, okay. And that's just on the one leg or both?
Well,
Just in one leg. Have you had any traumatic experience? Did you have an accident or something? Fall down, go boom on your butt?
oh, I've had lots of accidents.
Lots of accidents. Okay. Skiing accidents or motorcycle riding or?
I've been in several car accidents, had a concussion from racquetball. Just, I'm active.
Got it.
Follow a lot.
Okay. So what I'm looking for is some physical damage to the tissue here, or possibly to your low back. Did you fall down on your sacrum at all? I just want to rule that out to start off
Yeah,
with.
I can't recall that, no.
Okay, all right. So if you will get your body up here, we'll see what we can find. And let's try here. This neck feels pretty good, so we should have relatively full power down here. Are you experiencing not only, let's see, which side is it now? This one here, okay. Are you experiencing difficulty in your low back along with the problem here at all? Okay, and into this area too, or just in your butt?
Well, I definitely feel tightness in my gluteal muscles.
Yeah.
Super tightness, and whenever my piriformis or psoas are stretched, it feels better.
Yes, okay, all right. So let me test the strength of a couple of muscles here just to make sure where we're going. I'll test the psoas muscle here, see how strong it is. Hold up here real tight. I'm going to try to push it down. Don't let me do it. Hold tight. Okay, not too much strength there at all. If you will hold right there and hold your leg up again real tight. Okay, so it seems as though the muscle is okay. It's the power to that muscle that may be restricted. So let's hold the power source right there, see if we can jump it. We're going to do a jumper cable here and see if that'll make a difference with the muscle. Hold up here real tight. Oh yeah, okay. So it's a power source from the kidney circuit to that particular muscle that's giving us difficulty. Let me test another one. I want to see you right here, see if you can hold right there. I'm going to pull it this way, don't let me do it. Hold tight. Okay, once again, we have the piriformis muscle. Piriformis muscle is the little muscle there in your deep in your butt that it goes right over top of the sciatic nerve. And when that muscle gets tight, it's going to pinch on the nerve, and your whole leg looks like a toothache all the way down. Now, the pain, is it down through here, or is it up here too?
No, it's in the back mostly.
Back and through here.
Mm-hmm.
Okay,
Yeah.
so most of it is back in here.
Oh, yeah.
Right into there. Okay, so now, let me just point something out again. Where I'm finding back here is the urinary bladder circuit. So I will then ask you then, is this tender up and through here?
Yeah.
Yes, okay. So that confirms that the urinary bladder energy is involved in the process. And we said before with a previous person here that there's a relationship between the kidneys and the bladder. They live in the same house together, so they share energy. So when the kidney circuit is in trouble, the bladder circuit is also in trouble, and conversely. So let me ask you something. Are you experiencing bladder infections at all? Have never, or it's not a chronic problem with you?
Years ago, I had urinary tract infections.
Yeah. And it was chronic? It was
Yeah,
going on for a while?
Yeah, but it's been many years.
Many years, okay. All right, so there's a weakness in the circuit that we need to pay attention to. We'll put that in the back of our mind, file it for future reference. Let me ask you this, is this tender into, oh yeah. Okay, so kidney circuit is definitely part of the problem here. And let me ask you this here, is that tender right in through here?
Right there.
Right there is a little tender, okay. So are you also involved in doing caffeine?
Yeah.
Yeah,
Mhm.
coffee, tea, soft drinks, chocolate, any of that stuff?
I drink coffee and I drink green tea.
Okay, on a regular basis?
Mm-hmm.
Okay, and did you just start doing that, or you've been doing it all along?
For the past probably 5 years, I've been drinking coffee.
Okay, how long have you had this butt problem?
About a year.
About a year. let's think about that one. You got a nice strong body, and it takes a while to drag you down. So after a period of time, pulling the energy out, finally it's given up on you. All right, so I can do a little jumper cable here trick and see if we can get some energy back into that muscle. So I'm going to hold this here and right here and put a jumper cable on it, you might say, and see if we can drain some of the energy around back to the kidneys again and see if we can tighten that muscle up, see if the strength of the muscle will improve, because this particular muscle is also going to be involved with the piriformis indirectly, but there is a functional relationship in there that we could take a look at. All right, now let's see if that made a difference here, and if you'll hold your straight leg, that's good. Hold tight now. There is a slight difference in the strength of that, yes?
A little bit.
Little bit, okay. So just a little bit of movement we did here made some difference, so that means that it confirms that there is an energetic issue to this particular weak muscle circuit. Let me see if I can, is this tender right into here?
Ow.
Yes, okay, so that is also another confirmation that the kidney circuit's involved in this. Let me ask you, how about this point right here?
Yeah.
Yes, okay, and I want to lift your leg up here, so tell me if it hurts when I do that.
No.
Okay, good. I just want to lift it up so that the camera can see here. This is where the pain is right through here, yes?
Yeah.
Okay, that's right along the bladder circuit. Okay, the bladder energy supply circuit is right along through here, and that's where she's complaining. So all these other confirming points here tell me that yes, there is a difficulty here with the kidney and the bladder circuit, which is draining energy from these muscles. Now this particular muscle back up and through here, I can, let me do a little pressure point here on this and see if we can get that muscle to come up to speed a little bit. This is going to be a little tender in here. Yep, okay, this is my torture technique here. Perfect combination of sadist and a masochist. Okay, now, all right, let me test this to see if there's any difference in the strength. Hold tight here. And there is a difference, yes? Okay, now can you tell me, when do you experience most of the pain? When you're standing, sitting, lying?
You know, I
It's hard to
mostly
say.
notice it at night because I'm not busy. You know, I'm
Aha.
distracted.
So when you're reclining, that's when you feel most of it?
Yeah.
Okay, you're flat out right now. Can you feel any pain in it?
You know, I never really feel pain. It's just an aggravation. Just
It's a
constant-
tightness.
Yeah, yeah.
Yeah, okay. And the reason for that, again, of course, is that it's getting a low supply of blood because of the low energy running down through here, but also when your weight is down on it, you're compressing and restricting more blood from the area. So the energy deficit right into here can be rearranged, it can be changed if we do some changes in your behavior and also in pressure points. I can show you some pressure points to use to alleviate some of the problem. We already showed you the problem in through here is related. The problem right in through here against this is tender in through there, and it's tender back up and through here, same side, or this one's a little bit worse in through
Maybe
here.
that one's worse.
This one's worse, okay. So this, I just want to mention that typically one side of your body is usually weaker than the other side. Okay, so when your energy starts to go down, one side is going to hurt first. So this particular side of this body is the one that's giving out first. If this continues over a long period of time, the other side will start to hurt too. The reason why I say that is because it's an energy deficit. All right? In other words, you need energy to run this machine. And if you hold the energy back, if you strangle the energy from this machine, it's not going to work. It's going to start talking to you, and the language it uses is pain. So once you understand what pain means, you can then take different steps to stop doing what you're doing to cause the pain. Okay? You got what you got because you did what you did. You keep doing what you did, you keep getting what you got. All right? If you want to change the pain, you need to change what you do because what you're doing is causing the pain. inadvertently. I mean, you may not know that, but now you do. Now you have another understanding of how this body works. So whenever you have a pain, there's a reason for it. And if you can understand what that reason is, you can change the behavior, the pain goes away. So it's that simple. We don't need surgery, we don't need drugs, we don't need all that stuff, unless of course you've been in an accident, okay? Traumatic damage, Western medicine is great. But as far as understanding the function of the machine, there's a lot left to be understood, all right? And some of us have figured out how to do this, and we're trying to get this information out to people. So, thank you much for your time, and I hope you feel better. All right.